Kentucky health officials have confirmed now the Commonwealth's first measles case in 2 years. It comes as West Texas deals with an unrelated outbreak leading to one child death there. And New Jersey reports now 3 cases. WCPO 9 News reporter Connor Steffen explains what you need to know to stay safe.
Kentucky Department for Public Health officials say the measles patient is an adult. They recently traveled outside the U.S. to a place with ongoing measles transmission.
I would say that probably it follows suit with just about any other virus. You know, immunocompromised, people who are elderly, people who are extremely young, potentially could have greater consequences of contracting measles.
Dr. Jennifer Mooney is the Northern Kentucky Health Director. She says the case reported in Frankfurt poses a low risk to the region, but it's important to stay vigilant.
I think the thing that people need to be mindful of is that measles lingers for quite some time.
Right now, Kentucky officials are working to contact trace. They've honed in on this Planet Fitness in the area where the infected patient was a week and a half ago.
I didn't know anything about the measles outbreak until actually last night when I saw it on the news.
The MMR vaccine protects best against the airborne disease. But in recent years, the Commonwealth has seen falling vaccination rates.
I do think it is disheartening when science has paved a way for us to create healthy communities, especially for our children, prevent unnecessary death. And yet we're seeing ourselves take steps backwards into a pattern where this could become more and more common as time goes by if people do not trust the vaccine.
Per CDC numbers, Kentucky's MMR vaccination rate among kids is below the national average and has dropped nearly 3.5% since 2018 to 90%. Dr. Mooney says the vaccination rate in the Northern Kentucky region is higher at just above 91% for all ages. Measles herd immunity is reached at 95%. If you're unvaccinated and believe you've been exposed to measles, you should self-isolate for 21 days according to health officials. If you develop symptoms during that time, you should immediately call a healthcare provider. We're in Florence. Connor Steffen, WCPO 9 News.
According to health officials, early symptoms can appear about a week to a week and a half after exposure. They include high fever, cough, and red and watery eyes. And there's also the measles rash to look out for. It typically shows up to 3 to 5 days after, starting in the face usually, then spreading to the rest of the body.